to Virginia This Morning.
Well, you may be coughing and sniffling and sneezing with allergies this season, and so might your dog. There are a lot of things that can cause pet allergies, but the most common things are pollen and mold and food even.
Yeah, the most common causes of skin and ear diseases, primarily in dogs and cats, they're caused by allergies. Local veterinary dermatologist Dr. Nicola Williamson is here today with her little pooch, Chloe. It's great to see you.
Thank you for having me here today.
And hello, Chloe. Chloe looks like a happy dog. And does Chloe have allergies as well?
She does. She is affected by allergies more in the summertime than in the springtime, but she is a paw licker, a foot chewer when her pollens come out. So,
how can you tell that your dog has allergies?
You can tell dogs that get recurrent ear infections, 80% of them have allergies. Dogs that chew on their feet, lick on their feet, nibble on their arms, scratch at their armpits, those are all symptoms of allergies. So they tend to get skin problems and ear problems instead of the sniffling and the sneezing that humans get. Cats are more respiratory than dogs, but they can also overgroom their tummy, and that's their primary spot.
Now, we can just run to the local drugstore and get some antihistamines or anti-allergy medications. Is it the same for pups and cats as well?
Dogs and cats can receive antihistamines. I would recommend that owners contact their veterinarian to get doses because it does vary a lot because of their weight. But antihistamines may help in mild cases. Luckily, Chloe has helped with antihistamines, but other dogs will need more intervention. They will develop secondary infections and will need treatment for yeast and bacterial infections. Some may need steroids, and others may actually need allergy testing and be placed on allergy shots to help control the symptoms in the future.
Are there any particular breeds that are more susceptible to allergies than others?
Golden retrievers are definitely way up there on the list. German shepherds, any breed of dog that has terrier in the name, their terriers are just very predisposed. Boxers are predisposed, dachshunds. Any purebred, it seems, are more likely to be affected by the allergies than the mixed breeds.
Is there something you can do on a daily basis if, in addition to the medications, the dog has to go out and do its business as well? I'm sure they pick up some things around the yard.
They definitely do. When they go outside, they come in contact with a lot of allergens. So washing them off weekly, twice weekly with a mild shampoo will help remove the allergens from their coat and make them more comfortable. Wiping them down with a damp towel, wiping off their feet will help remove the allergens to help make them more comfortable.
When pets have allergies, they're just as miserable as we are, so we have to make sure they get the right treatments, right?
That's correct. That's correct. And when they're miserable, we're miserable.
And there are pets that we have to take care of them and give them the proper treatments. If it means bathing them twice a week, then we have to bathe them twice a week.
Correct, correct.
How about the medications in terms of prices? Is it very expensive to get the allergy medicines and antihistamines?
The allergy shots, once we get them started on allergy shots, it runs about $300 to $350 a year for maintenance of allergy shots, which is not too bad in the grand scheme of going to the vet every other week or monthly if they're not treated.
Under $1 a day.
Under $1 a day, yeah, less than Starbucks.
Now, we mentioned food allergies. How common is that in a dog or a cat?
Food allergies occur in less than 5% of the population, and but it can cause very similar symptoms. They can be more afflicted with itchy bottoms than with ear problems and things of that nature. So if your dog is a scooter, that's an indication that they may have a food allergy.
You may need to see the doctor.
Now, when you get the antihistamines and you administer the drugs to the dog or the cat, how long after should you notice a difference, and what kind of difference you can see?
We can see a decrease in the symptoms as quickly as a few hours. Some antihistamines may take about 5 days to get into the system. So if they're not working after about 5 days, then we need to change antihistamines or go on to something stronger.
Well, thank you so much, Nicola. And Chloe, thank you. She's a good girl down there. She's hopefully allergy-free.
Yeah, for right now.
Hopefully no allergens in our carpet. Thanks for coming in today.
Thanks you.